Today's video we're going to show you how to set up for the insertion of a Swan Ganz catheter at the bedside. I think most of you have noticed that we've been starting to do a lot more of them, and we just want to make sure that this video helps everyone to not feel as stressed and to be able to set up quickly and efficiently for a bedside insertion. The first portion of this video is just going to show you what supplies to assemble. Make sure that you have a signed informed consent, as well as you fill out the timeout documentation sheet prior to the line insertion. You need to bring the central line cart outside of your room, and inside of the cart it contains everything that you need for a sterile line insertion. Your chlorhexidine preps, your sterile drapes, your sterile flushes, sterile gowns, caps, and masks for anybody that's going to be inside of the room assisting with the procedure. The next portion of this video, Darcy's going to go through setting up your pressure cables and your lines.
I'm going to be going over the equipment you're going to need to set up the Swan Ganz. The first thing you'll need to grab is 3 pressure cables. You'll also need the bifurcated pressure tubing, a 500cc bag of saline, and a pressure bag. You'll need your Swan Ganz, and you need to make sure it's the CCO. This is an 8 French that we carry. With that, you'll need the introducer. We have an 8.5. You can use an 8.5 or a 9 French. You will also need the Swandom sleeve to go over the Swan Ganz, and your SVO2 cables. And next, we'll show you how to prime and set up the pressure tubing. This portion of the video will review how to set up the pressure tubing line. For the Swan Ganz, we're going to use the triple bifurcated pressure tubing. And to set it up, you will need the tubing, you'll need a 500cc bag of saline, and a pressure bag. You insert the saline into your pressure bag, clip it onto the little hook here, and before you inflate it, you spike the saline bag. At that point, you take the spike back out, invert it, and expel any air that's left inside the 500cc saline bag. You put the spike back in, and you inflate the pressure bag to the green level, which is 300 millimeters of pressure. After you inflate it, make sure you turn the stopcock off to the up position, otherwise the pressure bag may go flat. Once you've done that, you need to prime the tubing, and on this one we have a transducer for each line. They're color coded for us already, so we have the red one for the A line, the blue one for the CVP, and the yellow for the PA line. To prime the tubing, you simply pull the pigtail on each one until the saline comes out the end, like so. You do each line, and then you also need to change all of your caps from the clear ones to the blue ones. When you're changing the caps, you turn off to the line, open this, and then prime that little last piece of air and put the new blue cap on. You do that for each one, and then you will set up your pressure cables. When you put the cables into the monitor, you need to make sure that you have the correct label. So just be mindful of where you're putting it. When you connect the A line cable and then put this onto your brain, you need to make sure you label that one A line, and same for your CVP and PA. Segment of our video, we're going to review how to set up our pressure cables to the monitor, label them correctly, have everything zeroed. All of this needs to be done prior to the physician coming in to insert the Swan. It's important to have everything ready so that when he comes in, we can just insert and go. A few things: when you're priming, you need to make sure that the vamp has no air in it either, and it's been fully primed. There's also these 2 ports down here that I changed the blue caps on as well. So there's 3 up here and 2 down here, 5 total to change. Additionally, if you're using the when you're using the triple pressure tubing for the Swan and you do not have an A line, you can just disconnect this and cap it off, and you don't need to use it. So to set up the cables, it's easiest, I find, to do it one at a time and label them on the brain as you go. So I'll do my A-line first. And in this pressure tubing kit, it comes with the stickers. So additionally, you can label the cables, so it makes it easier for the next nurse. So the red is always the arterial, and you can label the A-line up here as well. Now when you insert your cable into the brain, you can choose any port. When it comes up, this one happened to be arterial. If it's not, you just push on it, press label, and change it to art. Okay, so the next one I will do is the CVP. So again, you need 3 cables, pressure cables. And the blue one here is your CVP, and you can label the tubing again. So this time it came up PA. So you just press on the PA pressure line, go to label, and change this one to CVP. And then hit anywhere on the screen. Now it's CVP. Next, we'll do the PA line. And again, I'll label the cable, yellow there, yellow here. And the PA tubing is actually yellow as well. That one came up CVP as well. So you push on the, is that the right one? Sorry, just make sure it's the right. Okay, it's this one. So you push on CVP, change the label to PA. So then you hit anywhere on the screen. Okay, now it asks zeroing needed, and I've ignored it. Once all 3 lines are set up, we'll zero them all at once. So ideally we'll have our transducer holder here, and you can open each one off to the patient, open to air. And then, as we all know, zeroing needed, yes. And then zero all. We'll zero all 3 lines at the same time. Zeroing complete. Place your caps back on. One more thing I meant to say while priming your tubing is that I like to check these connections here. Sometimes they're loose, like this one, and it'll pop off at times, which can lead you astray. So just make sure you check all your connections and they're tight. And again, we like to have it zeroed, primed, set up, ready to go when the physician comes in. Thank you. This segment, we're going to go over the last step you need to do to prepare your room for the physician to come in and insert your continuous Swan Ganz. In this segment, we're going to go over the VIG 2 and setting it up and connecting it to your Swan prior to the physician being there. Step number 1, plug the machine in. As it's booting up, you can go ahead and slave it over to your monitor. The connection is in the back here. And that way you'll be able to see your numbers up on the monitor as well. After you've plugged it in, you can turn it on with this green power button here. It says clear patient data profiles. We'll say yes because this is a new patient. The first step will be inputting your height and weight. So these are things you need to know prior to getting here. So our patient will put in centimeters is 170 centimeters. Scroll over to weight, click it once, click it for kilos, and 80 kilos. Click it again. It automatically does your BSA, so you continue to scroll until you get to continue and click again. At this point, you can insert your 2 cables, red to red, brown to brown. And now you take the cables, you'll be opening your Swan box at this point. Remember to make sure you get the 8 French Swan that says CCO SVO2. The other one does not do continuous, and you need to do the manual boluses, which you won't be using the VIG2 for. When you open this, you can actually open a portion of it before you get to the sterile part. So this is the part you need to open prior to the physician coming in. It'll tell you right here that you can open here and to fold here. This part will not be sterile. So you just open the corner, and this is gonna show you your cables to connect. Okay, these red caps come off, and you connect this. This is your thermistor. I don't know if you can see, there's a groove and an arrow. You line up the arrow with the groove, push, and then screw that part on to connect it. And the blue one has a flat edge. You line the flat edge and the groove up and just push it in. And on your red cable, this is the OM. It is the brain of the Swan. So all the information is stored in here. So you insert this blue part, it says top and top. You push, and you kind of have to push hard, and it clicks in. At this point, you can go ahead and get your physician and let him know that you're ready to insert the Swan. Okay, now that your pressure lines are zeroed, your cables are connected, we're going to talk you through the part of doing an in vitro calibration. The in vitro is outside of the body. You do that prior to the insertion of the Swan. Everything's connected. You scroll over until the yellow box highlights the SVO2, and you push there. And now you scroll down. It's going to go through these 3 first and then jump over here. You just keep going until it comes back to the in vitro. Push again. And at that point, you're going to put in your most recent hemoglobin. Even if it's the AM hemoglobin, that's fine. So we'll put in a hemoglobin of 9. You just scroll until you get to where the hemoglobin is and push. Once your lab values are correct, you push on calibrate, and it'll say ready in 20 seconds. As it's counting down, it's doing its own self-test, and then it will say calibration complete. Once the Swan is inserted, you can do an in vivo calibration, which is inside the body. It's actually a bit more accurate, and we should be recalibrating daily, usually with AM labs. To do the in vivo calibration, it's the same steps, but you go to in vivo, and you need to, when you push calibrate, it will ask you to draw. At that point, you draw an SVO2, ask the RT to run it, and you come in and put your lab values. When it asks you to draw, it actually holds those values so that it puts the values of the labs back into the machine at the exact time of all the other numbers to do its calculations. At this point, our in vitro is finished, and once it says insert catheter, then select start. So now the physician is able to insert the catheter. Once it's in, you can hit start, and you'll get your numbers automatically. At this point, you are ready for the physician to come in. You've told him that you're ready. You have your pressure cables zeroed and set up. You have your VIG2 set up, calibrated, ready to go. Everybody who comes in the room now needs to have their sterile gown, gloves, mask, and hat. The physician will set up his own sterile table with his supplies that you have in the line cart right outside the room. You also need to make sure that the timeout in the consent form is completed. The rest of the SVO2 catheter can fold back, but wait for the physician to be in here, because sometimes they have different preferences. You want to make sure you don't go anywhere past there. These cables will stay as clean as possible, but will not be sterile. This is what you are going to be handling for the physician to float the Swan in. The first step will be connecting and priming these lines. Again, you don't want to do this until the physician is ready. You can connect them, but don't actually prime them until he's ready so he can see that all the air is expelled. It's nicely color-coded for you. So you're going to take your CVP line, which is yellow, and connect it to the yellow PA distal line. And then your your CVP line is actually blue. You're going to take your PA line, which is yellow, and connect it to the PA distal. Your CVP line, which is blue, and connect it to the proximal injectate. And these are labeled on the Swan, on this white part. And then this is your VIP port. It says proximal infusion. This is where you can infuse, you can use it as a regular line to infuse anything. So we will just prime it with a normal saline syringe. So you have all three set up. When the physician's ready, he'll tell you to go ahead and prime them. And you will do these two by pulling the pigtail. The third one just simply by pushing in. Your wedge syringe is in here. And this, like I said, is the part you just keep as clean as possible. This syringe, it's a 3 cc syringe, but it has a stop on 2 cc's. You cannot pull back farther than 1.5. It'll stop you there. So 1.5 is the max you can put in the balloon. And that's why this syringe always goes with the Swan. And it comes in the kit. The syringe hooks up to the red port, and you can see there's the arrow here. When the line is straight, the line is open. If you click it to the side, the line's no longer straight, it's closed. You can't put anything in. So again, to inflate your balloon, you need a straight line. At this point, the physician will ask you to test the balloon, and you would inject your 1.5 cc's and hold it down. It automatically comes back, so if you want the balloon inflated, you have to hold it there. The other important part about when you're setting this up for the physician is that you want to make sure the monitor is set up in the wedge screen. So to do that, you push your PA line, and then on here there's a wedge button. You push the wedge button and it comes up to this screen. This way they are able to see the Swan floating in and see the waveforms. It's important to know that on the Nihokoden monitors, this screen times out after a while. So it'll probably time out during the procedure and you're gonna have to go through and do it again. So it'll go back to this main screen, push the PA line, and then the wedge line. The other important thing is that the physician needs to be able to see this, so you're gonna have to set it up where he can see it. At that point, the physician will walk you through what he wants you to do next as far as priming, handing him things. I find it easiest to hold all of these lines in your hand because the rest of this will be sterile and cannot touch anything but the sterile field. So you need to, keep a whole tight grip on this because otherwise the heavy things will weigh it down and it'll fall on the ground.
In this video, we're going to discuss the setup for an open heart room. The objective of the video is just to ensure that all of the supplies are organized in the same way and emergency drugs and drips are always in the same place so that they can be easily accessed and are ready for use. This isn't a style or nurse preference, but it's rather a system that we've developed here at Casa Medical Center that will allow us to always be prepared and be able to assist our team with less confusion and less chaos. If there's a scheduled open heart, the night shift can start the process by ordering 6 IV pumps for the open heart room, and also make sure that you order enough so that there's an adequate supply of extra pumps for the other patients in the unit. The next thing that you can do to start to prepare for the open heart room is make sure that the room assignments are rearranged so that our hearts will either go into bed 2 or bed 3. We also need for you to free up either the sport or the striker beds, as the other beds are not easily maneuverable to and from the operating room and don't have the footboard here. We want to make sure that you please remove all extra furniture that may be in the room, any chairs or any fans, and that the booms are properly situated so that the booms, the monitor is on the right side of the patient. It's really important in the event of an emergency or an open chest code. We also want you to make sure that you clear the back hallway to the ICU of any equipment so that there's easy access to and from the ICU. We would like for you to zero the beds as you usually do. The only thing that we would like for you to do is double line the bed so that after surgery we can just easily change the patient onto clean sheets. Next thing we need for you to do is set the transport monitor up onto the foot of the bed. These straps here are located in the bedside table that's below the iStat machine between beds 2 and 3. You need to take the brain out of the Nihon coated bedside monitor and insert it here into your transport cable, transport monitor. We want you to secure the straps with the monitor facing the head of the bed so that the anesthesiologist is quickly able to see your vital signs. The only other things that you need to send down with the patient are you need to send down an EKG cable as well as disposable cables. We need to send down your SpO2 and your CCO monitoring cables. At the head of the bed, we also want you to send down a pacemaker. We like to hang it here. A dual chamber if we have one. If we don't have one, we need to call for OR and we can borrow theirs. We also need to make sure that they go with the alligator clips. For the day shift, the OR will call to pick up your bed at about 9 o'clock in the morning. When they do call for the bed, please make sure that you ask for them to send up extra blood band labels. The first nurse that arrives will need to pull from the Omnicell your open heart tray here of medications. We also go ahead and take your PCA keys and we pull and override a propofol as well as a fentanyl. For the room setup, there's a lot of equipment that will send as a list, but we need for you to set up at least a minimum of 3 canisters. One will be for your chest tube, two will be for your suction or for your NG tube. We also need for you to bring in the Ranger. We now have 3 Rangers, so we don't have to borrow any from the OR. This is the Ranger as well as the tubing. And that's for your rapid infusion. You don't want to use any other rapid infuser because it delivers too much pressure and you can blow your grafts. We have a system here for setting up your lines, your drips. And the reason that it is a system is that so that in case of an emergency, anybody can jump in and you know that your lines are going to be the same. So on this line pole here, we set up 3. This is going to be for, you're going to prime an albumin line, you're going to prime a propofol line, and you're going to prime a lactated ringers line with your piggyback setup. We preset everything up so that when the patient arrives, you can just have everything ready to go. I don't have enough pumps here, but we also will put either 2 or 3 pumps. This will be your pumps that are set and ready. The one drip that we do pull and we prime prior to the patient's arrival is cardine, and you want to have that ready. Everything should be lined and labeled clearly. On the back of your pole here, you would set up your fentanyl PCA. Dr. Louis likes to have his patients wake and rouse before we start a basal rate. So we just set it for, it's a 10 per 1 syringe, and we just set it for 10 per 10 mics per 10 minutes. Yes, no PCA. You can double check your orders on that, but just basically set it up with no basal and check your orders. This will have your nicardipine set up, an empty line, and then we also like to bring in 1 blood tubing that's already primed and ready to go. So that's it for your lines. The other thing that you need to make sure that you have the room set up for is just get your Vig 2 set up, and Darcy already discussed in the Swan video just about how to slave this to the back of the monitor. And then the instructions on top of the Vig here, and this is just a calibration just to make sure that all the numbers are the same as what appears on the screen. In terms of everything else that needs to be in the room, you want to have your bear hugger and the blanket, as well as your SCDs, all ready, everything in the room. What will happen is the operating room will send you a scout sheet. It'll come up by fax. Check your scout sheet. They'll give you a 30-minute call. At that point in time, when it's 30 minutes out from the arrival of the patient, somebody needs to go down to blood bank and pick up your 4 units of blood. If day shift has forgotten to get the blood bank sticker, at that point somebody's going to have to go to the OR and get your sticker. You can pick up 4 units of blood that we keep in the room. We've been setting a timer on our iPhones because you have 4 hours to return that blood before we have to waste it. The other things that you can do once you get the scout sheet is the secondary nurse needs to put in all of your lines into the computer, set up all of your drains, your tubes, your lines, Foley, chest tube, pacemaker wires, and also on the scout sheet they'll tell you what drips are currently running. You'll get one more phone call prior to the time that they are actually transporting the patient upstairs. At that point, the charge nurse or the secondary nurse goes into your order set, and you want to delete all of the pre-op orders. It makes it cleaner and easier for you to go through your order set. The last thing that I want to go through is the paperwork that you'll need to do your open heart. It's also in the cabinet where the iStat is. On the bottom there's a file folder in there, and inside of that it'll have your PCA flow sheet, it'll have your Portland protocol, your insulin drip form. It'll also have your flow sheets for your I's and O's, as well as the flow sheet that we use to document your drips and your vital signs until you're able to take your vital signs that are in your transport monitor, take the brain out, and put it back to your bedside monitor. At that point, it'll slave over into your computer. The other thing you want to do when you get your final call is make sure that RT is aware that the time has come where the patient's going to arrive, and they will be ready. We also set up at some place in your room, usually it's where RT is standing. You want to make sure that you have your stickers for the patient, and on that bedside table you want to make sure you have everything for your labs. All your blood products are going to go down, your lab specimens will go down in a yellow bag. And you also want to make sure that you have everything labeled as much as you can. You have your iStat and cartridges, you have your glucometer and your test strips, as well as your tubings and your vacutainers and alcohol prep pads. So the big thing is preparation is key. Less is more in the room in terms of getting anything out of the way that you don't need, and making sure that everything is ready for when the patient comes out. We hope this video was helpful to you, and we'll see you at the next one.